Good afternoon, everybody. It's Dr. Galvin with today's coronavirus update. Today is Wednesday, March 25th, and here we are back another day. Cases are increasing, more people are locked down. Current numbers globally, I think up above me here, 459,000 cases, close to 21,000 deaths. In the US, about 62,000 cases with about 870 deaths. Here locally in North Carolina, I think we're up to 500 cases, and we just had our first death, and I just heard from a physician probably 2 deaths just today, and that actually happened in the county that I live in here in Cabarrus County, which is just north of Charlotte. The numbers are increasing. About half of the cases in the US are coming from New York City, and I heard a number today, although I haven't confirmed it myself, that said that the cases in New York are tripling every 3 days. And if that's the case, they are looking at a massive, massive disaster there. They were heavily infected to begin with, and we're pretty surprised by all this. They've tried to lock the area down, but it's like a couple different cars heading towards the end of a cliff, and one of them had a big heavy car, and it was going really, really fast, and it started before everybody else, and that's kind of New York right now. Many other states have had a little bit more time to prepare, and the growth rate has been lower. I think New York is probably heavily infected because of all the international travelers that come there. So we still have time to mitigate the effects elsewhere, but I think New York is really looking down the barrels of a really big disaster, and our prayers have to go out to them. Before I go on a little bit farther, we have a lot of viewers every day now, and I really appreciate it, but some of you may not know who the heck I am, and why am I up here talking about this and not some talking head on CNN? Well, I'm a board certified emergency medicine physician. I've practiced emergency medicine for about 25 years. About 10 years ago, I opened Fatality Medical Wellness Institute out of really frustration with traditional medicine. And this is a functional medicine practice where we really optimizing personal performance, optimizing nutrition, fitness, stress, sleep. We work with executives and athletes. We do concierge medical care, and we try to do things in a different way than most. But that's what I do on most of the time, but I still work in the emergency department because I love it, and I still work a number of shifts a month. And so I've got a perspective where I'm on the front lines with everybody else, seeing what's happening firsthand, and also have some experience. I was also in the military, so I have some experience with disasters and things like that. Anyway, I told you yesterday that today we were going to cover some viewer questions, and we had a bunch of really good ones. And I want to start it off with somebody who asked me to give me a distribution of how the deaths have been breaking out, like in terms of ages and medical problems and things like that. And it's very interesting. Oxford has a site where they track this, and the numbers are pretty up to date as of a few days ago. And the case fatality rate, or the CFR, ranges in the world between about 12%, which I think is Bangladesh has a 12% fatality rate, to a low of 0.1%. US right now is about 1.4%. Italy is about 10%, meaning 10% of the people that are getting diagnosed with COVID are dying in these countries, whereas 1.4% of the people who are being diagnosed here are dying of the disease. How do those numbers break out? Well, it turns out that if you're less than 9 years old, the fatality rate is essentially 0, which is great. If you're between 10 and 19, your fatality rate is 0.18%. If you're 20 to 49, it's 0.32%. So again, very, very low. 50 to 59, 1.3%. Numbers start going up from there. If you're between 60 and 69, it goes up to 3.6%. 70 to 79, it goes up to 8%. And for those over 80, the fatality rate, if you catch it and are diagnosed, is over 15%. So you can see that distribution really does skew towards the older. In terms of medical problems, people that are perfectly healthy have a pretty low risk of this turning into something bad, with the exception of healthcare providers, which do seem to be a lot of young emergency medicine doctors and nurses and things like that seem to be getting sick, but that may be related to the amount of exposure they get. But the biggest risk factors are cardiovascular disease, diabetes, chronic respiratory disease like COPD, pulmonary fibrosis, problems like that, hypertension, and cancer, which would be something that would lower your immune system. The interesting thing they did on that Oxford site is they actually calculated what the individual fatality rate is, which means that when we look at these case fatality rates, we're basing that on the number of diagnosed people, which means that people that have been tested, that we know have the disease, and then subsequently die. But we know for everybody that we test that is positive, there's probably 10 more that are positive that we're not testing, that are going to get minor symptoms, and we're never going to know. So they came up with a number called the individual fatality rate, which means that assuming normal population and normal epidemiologic distributions, what's the fatality rate for the actual population that actually has the virus? And their feeling is it's 0.2%. So if the virus is broadly distributed in the population, 0.2% of those people that have it are going to die. And 0.2%, that doesn't sound too bad, right? Well, if you think about if this goes unchecked, and let's say that 60% of the population in the US end up coming down with some form of COVID, be it extremely mild to life-threatening, and 0.2% of those people die, that equates to 420,000 deaths. If we extrapolate it to the 8 billion people in the world, that extrapolates out and 60% get it, it's about 10 million deaths. So it's a huge number of people that could potentially die really in the next month or two if we don't get this under control. So again, we just need to kind of take this seriously. I have gotten some weird messages and comments from people that really are saying, bah humbug, this is all a bunch of nonsense. It's been around for 6 months and you don't know what you're talking about. Remember, our testing is growing linearly, meaning that it's sort of slowly ramping up. The positives are increasing exponentially. As a matter of fact, you can see it right here. That's an exponential curve. Our testing is not doing that. So we're seeing far more cases because it's being distributed in the population. I've actually offered one person in particular, if you want to come down to the emergency department and hang out with me for a shift, you're welcome to. Since it's not that big a deal, you won't need to use up any of our personal protective gear, and you can just go it on your own. But since it's not a big deal, it shouldn't be a problem for you, right? Anyway, on to the other questions. I have a question from a healthcare provider that has symptoms and went to their doctor and were told, yeah, you've probably got COVID, but we're not testing you, go home and quarantine for 2 weeks. And they're upset with that, and I understand why. But I also understand that there are limited numbers of tests, and that's what doctors are being told to do. Mild symptoms, treat it like COVID, have them self-isolate, self-quarantine, and if they get worse, come back in. It's not satisfying at any level. And hopefully, as testing becomes more and more available, that won't be an answer that you'll hear. I've gotten a lot of questions about the combination of chloroquine and azithromycin or some of the other medicines that have been bandied about. These are not cures for this disease. I think Dr. Oz said it was a cure. It's absolutely not. There's been one study that came out of France that included 40 people. And the endpoint they measured was not whether the people got better or not. It was whether or not they still had virus detectable in their nose. And they dropped out some of the sickest patients, and it was a kind of a horrible study, but it indicated that maybe they got a little bit better. So chloroquine and azithromycin is being used in a lot of hospital protocols. They're being used as a protocol in my hospital. We don't know if it works. There are many, many studies that need to be done. It's certainly not a cure for this. Routine medical visits. Someone asked about, should routine medical visits be done or not? If you've got a routine follow-up, you see your doctor, your specialist maybe once a year for a follow-up. Should you go to those appointments? No, I don't think you should. Why? You're going to expose yourself unnecessarily to people that may have the virus for, something that's, can easily be put off a month or two. Now, obviously, if you're a week post-op and you need your stitches out, then you need to go. But I would say that the majority of routine visits can be postponed for a few months unless it's a life or death thing. How did South Korea flatten the curve? Well, South Korea has a really low death rate, and they were able to flatten the curve quite a bit. They rapidly rolled out testing. They essentially removed all regulations, and 4 or 5 Korean companies came out with very quick tests, very, very rapidly deployed them. They also, grossly violated the privacy rights of their citizens by tracking everybody's cell phone. So if you came in contact with somebody that had a positive test, they could contact you and say, hey, your cell phone was near this person, so you need to quarantine. And so by doing that, they've been able to severely limit the spread. That's probably not going to be something that Americans are going to go for, but the more limiting of contacts we can do, the better off we're going to be, and we've talked about that many times. Weather effects, we still don't know whether warm weather is going to cause the virus become less active or not. Somebody asked me about antibacterial soap. We talk about hand washing all the time. Do you need to use antibacterial soap? No, just soap. Soap is lipophilic. It tends to break apart fat. So if you have a greasy pan with oil floating on the top and you drop some soap in there, what happens to the oil particles? Poof, they spread apart. The coating of the virus has lipid in it as well, and soap breaks that apart. It doesn't have to be antibacterial soap. It just has to be soap. Last question was about co-infection. If I go to my doctor and I have the flu, can I still have COVID? Yes and no. So there is a co-infection rate. We think it's somewhere between 0.1 and maybe 8%. There are different things that say, different studies that have been published. What that means is that 0.1 to 8% of people that have a diagnosis of COVID have another viral infection as well, be it the flu or some other respiratory virus. But if you look at it from the other perspective, it means that if you have the flu, like a strep test or a flu test that's positive, the risk of you having COVID as well is somewhere between 92 to 99% against. So it's highly unlikely if you have a diagnosis of another infection that you've got COVID as well. So hopefully I've answered those questions. We're going to continue to answer questions. We are going to do a Facebook Live tomorrow or Friday. I haven't decided yet. I have to look at my schedule. We will take live questions at that point. Please keep leaving comments. I try to read them all myself, or if I don't read them, my staff reads them, and I really do appreciate it. I love to hear what people have to say. If you think this is valuable, please share it with your friends. Tell them about us. We'll be back every day, and I'll try to keep you updated. As I always say, actually, before I leave, back to personal protective equipment. We talked about that yesterday and how there's such a lack in the hospital. And the other night when I worked, I had to use the same mask the whole night. Since that time, gotten a lot of messages. We've had 3-4 different people donate masks. They brought them by the office. Somebody brought them by my house today. I cannot tell you how much that's appreciated. If you have masks, if you have face shields, goggles, if you're making masks, I got a lot of questions about making masks. Definitely make them. There are instructions on the internet on how to do it. You don't need to get them to me. Go to your hospital, your EMS people, whoever, give them to somebody. I don't personally need them, but if you want to give them to me, I will collect them and I will distribute them at the hospital. But again, thank you so much for the support and for thinking about us that are out there fighting the virus. And remember, it's not the doctors that, it's everybody. It's everybody from our nurses who are awesome, and our techs who are awesome, and our respiratory therapists, and our security guards, and our cleaning ladies. And there are so many people that are required to take care of sick folks, and they're all heroes in my mind. So please continue to support them. Hopefully more protective devices will come available as we move along. As I always say, wash your hands, take care of yourselves, take care of your families, take care of those around you. I will talk to you tomorrow. Have a great night.